Hello students, today's topic of discussion is drugs used in congestive heart failure. In this I will discuss introduction, classification and mode of action of drugs used in congestive heart failure. So congestive heart failure is a clinical condition in which the heart is unable to pump enough blood to meet the metabolic needs of the body because of pathological changes in the myocardium. Cardiac muscle are also known as heart muscle or myocardium. These are one of three types of vertebrate muscles, with the other two being skeletal and smooth muscles. The three main causes of congestive heart failure are coronary artery disease, diabetes mellitus, and hypertension. These conditions cause ventricular dysfunction with low cardiac output, which results in blood congestion and poor systemic perfusion. Here, poor systemic perfusion is the inability of the heart to supply an adequate amount of oxygen to the tissues to meet metabolic needs. This is the direct result of a reduced contractility of the cardiac muscles, especially those of the ventricles, which cause a decrease in cardiac output, increasing the blood volume of the heart. As a result, the systemic blood pressure and the renal blood flow are both reduced, which often lead to the development of edema in the lower extremities and the lung, as well as renal failure. Few groups of drugs known as the cardiac glycosides and vasodilators were found to reverse most of the symptoms and complications related to congestive heart failure. Classification of drugs used in systemic heart failure include two main categories: inotropic drugs and vasodilators. Digoxin and digitoxin are inotropic drugs, while nesiritide, tazobactam, and bosentan are vasodilators. Following are the structures of inotropic drugs. These are structures of vasodilators, bosentan and tazobactam. Now first of all, we will understand mode of action of inotropic drugs, digoxin and digitoxin. The process of membrane depolarization or repolarization is controlled mainly by the movement of three ions: sodium, potassium, and calcium in and out of the myocardium cells. The sodium-potassium exchange requires energy and is catalyzed by the enzyme sodium-potassium ATPase. The sodium-potassium ATPase pump maintains the gradient of a high concentration of sodium extracellularly and a high level of potassium intracellularly. The sustained concentration gradient is crucial for physiological processes in many organs and has an ongoing role in stabilizing the resting membrane potential of the cell, regulation of the cell volume, and in the cell signal transduction. By inhibiting the sodium-potassium ATPase, cardiac glycosides cause intracellular sodium concentration to increase. This then leads to an accumulation of intracellular calcium via the sodium-calcium exchange system. Elevated intracellular calcium concentration triggers a series of intracellular biochemical events that ultimately results in increase in force of contraction in myocardial cells or a positive inotropic effect. So digoxin and digitoxin increase the force of contraction of the heart, a positive inotropic action which underlies their use in some cases of heart failure. Next is mode of action of nesertide. Nesertide is the recombinant form of the 32 amino acid human B-type natriuretic peptide which is normally produced by the ventricular myocardium. Nesertide binds to guanylyl cyclase, which is a receptor on the cell surface of a vascular smooth muscle and endothelial cells. This receptor binding triggers intracellular activation of secondary messenger cyclic guanosine monophosphate, leading to relaxation of smooth muscle and balanced vasodilation. Nesertide mimics the actions of endogenous B-type natriuretic peptide by binding to and stimulating receptors in the heart, kidney, and vasculature. Nesertide has venous, arterial, and coronary vasodilatory properties that reduce preload and afterload and increase cardiac output without direct inotropic effects. Next is mode of action of bosentan. The mode of action of bosentan is competitive inhibition of endothelin-1 receptors. Endothelin-1 is a potent vasoconstrictor which also mediates cell proliferation, fibrosis, and inflammation. Endothelin-1 is a 21 amino acid peptide that is produced by the vascular endothelium. It is a very potent vasoconstrictor that binds to smooth muscle endothelium receptors, of which there are two subtypes, ETA and ETB receptors. These receptors are coupled to GQ protein and receptor activation leads to the formation of IP3, which causes the release of calcium by sarcoplasmic reticulum and increase smooth muscle contraction and vasoconstriction. The other drug candidate tazobactam also have similar mode of action. Thank you.